So when an attorney hands you a case, what are the first three things you're looking for in those records?
Um, I am looking, it depends on the case for sure. So I am looking, if it's, let's say an injury, then I am looking at, when did the injury occur? So a timeline. So I'm looking at a timeline, and then I am looking for when I identify when that injury happened. Who was involved in that, what led up to it, were there any issues that happened that led up to that? So they didn't follow protocol. So those are like all the records, and do I have all the records that I need to explain that?
So what are the most common pieces of missing documentation that can make or break a case, and how do attorneys not know to ask for them?
Okay. So again, the full autopsy report was one of them. So you could have MRI records, CT scans. Um, if we have sometimes vital signs or medication administration records, if there are medications. With the medication, so a lot of times an attorney doesn't know all the medications and maybe interactions, or like if you're giving two medications together, that wasn't good. That wasn't a good thing to do, because then it's going to affect their respiratory rate or things like that, that they might skip through, like skim through and see like, oh, the medications, that's not really pertinent, or like, I don't see anything wrong here. So things of that nature. So medication administration records. So like in birth injury, so maybe fetal heart rate reports. So there might be different, more, how could I say, specialized reports, and having that specialty nurse to be able to hone in on that. Oh, okay, I need these reports, whereas they might skim through that and not know. So
So walk me through what a medical chronology actually looks like. What does an attorney get at the end of the process?
sure. So with the medical chronology, they would get pretty much a timeline of the care. So if it was hospital admission, so from admission to discharge, it would be only pertinent to whatever the issue was. So if it was a patient injury or negligence, then it would be anything that was leading up to that negligence. So for example, if there was a patient with wounds, so if there were instances where the nurses were not turning the patient every 2 hours, so just pointing that out. Maybe they weren't getting the proper nutrition or different things. Maybe they weren't assessing the wound like they should have, or doing the weekly checks on it, measurements, things like that. And in that medical chronology, it would also break down the different diagnoses, medications, how everything connects together. And then at the end, we usually do an opinion as far as if we feel like they didn't meet the standard, and this is why, and this is what the standard is, this is how they didn't meet it, and then the definitions of different diagnoses or things, any medications or anything like that, and then also our research. So
So how long does a typical medical records review take, and what affects that timeline?
it depends on the amount of pages, and so you typically we run about like 100 pages an hour as far as reviewing the records. And as we're reviewing, we're putting that any information into that medical chronology. And so depending on the amount of records, and sometimes we could have 4,000 pages, and like I was telling you, there could be records in there that are not really pertinent, like maybe vital sign sheets, and it's not really, we don't really need that. So we could skim through some of that, like it's not necessary. So it could take us less time. So I always just try to get them, or whenever I do an estimate, I will let them know like it's probably going to be a range about 100 pages an hour.